Dr. Bud Green here. Welcome to our segment on use of medical marijuana. This segment is just meant to be an introduction to some of the uses, but also some of the dangers associated with the use of medical marijuana. We're going to try and put this right up the middle as much as we can based upon clear scientific evidence. This is not going to be something that people will enjoy if you blindly think that cannabis is a panacea, cure-all. There are potential problems with it. It's also not going to be a segment that you're going to enjoy if for whatever reason you feel that it has no place in medicine today. That's simply not true. Everything that we use as a medicine comes with some degree of risk. As said by the 16th century physician and philosopher Paracelsus, the dose makes the poison. And that is true for everything, even something as simple as water. It is possible to kill yourself by drinking too much water, as some radio contests have figured out in the past. So what I want to do is just kind of talk about some of the things that marijuana is good for, but also the risks associated with it. So clearly, it's very good for things like glaucoma. It's very good for chronic pain. It's very, very good for anxiety and post-traumatic stress. It's good for irritable bowel. It's good for nausea. It's actually an excellent appetite stimulant for people who have wasting due to cancer or other immunocompromised conditions. But it also comes with some consequence too. Does it cause sedation? Of course. But then so does Xanax. So does an opiate medication. You have to be careful with what you're doing. You also have to keep in mind that because of the sedation and slowing of reflexes and things like that, you probably shouldn't be driving a semi while you're using this or flying an airplane. Clearly those things are subject to drug testing for a reason. Don't do this if you're in a safety-sensitive position. But for those of you who are not, it's a reasonable choice as a medical alternative for some things that are infinitely more addictive, such as benzodiazepines, such as Xanax or Valium, or for opiates. It's a reasonable way to go that will cause less problems in the long run than any of those medications. Having said that, one of the things that I think is a potential problem is that not enough word has been spread regarding the potential risks of the use of medical marijuana. If you're pregnant, you really don't want to use that. If you happen to be suffering from emphysema or COPD, you probably don't want to smoke, although edibles are a reasonable alternative in that case. You need to consider everything else that is going on and look at your life or the patient's life as a whole and figure out if the use of medical marijuana is a good thing for you. And hopefully, in the future, we'll be putting out more segments that get into more detail about the benefits and risks of medical marijuana. It's a much more complex question than I can address in simply a few minutes in this video today. For any of those who happen to have any further questions or have topics that they would like considered for a future discussion, please email budgreenmd, that's BUDGREENMD @gmail.com. As some of you might have figured out, Bud Green is not my real name, but I am a real doctor, and I will be happy to answer any of those questions for you as best as I can.
When the rain hits my window, I take me some